All right, Bruce, thank you very much. Tonight in Medical Rounds, a big milestone for Hartford Hospital's Heart and Vascular Institute. Doctors recently performed their 1,000th procedure known as a transcatheter aortic valve replacement. It's a less invasive surgery for patients with severe aortic stenosis. And joining us live right now is Dr. Robert Hagberg, the Chief of Cardiac Surgery at Hartford Hospital. Doctor, thank you very much for joining us tonight.
Oh, you're welcome. Glad to be here.
Let me ask you first up, exactly what is aortic stenosis?
Aortic stenosis is a disease that affects the aortic valve leaflets. Typically, they become thickened or calcified, and consequently, the valve does not open and sometimes does not close properly. You can imagine that that causes an enormous amount of strain on the heart. Symptoms associated with aortic stenosis include shortness of breath, chest pain, fatigue, and even fainting.
Well, tell me, doctor, about this procedure known as transcatheter aortic valve replacement. I understand there's an abbreviation for it. What does it involve?
Transcatheter aortic valve replacement, or TAVR, is a minimally invasive way of replacing an aortic valve. We start by introducing the valve into the blood vessels in the groin, typically, then advancing the valve through the bloodstream into the chest, and then deploying and anchoring the new valve inside of the old valve. You can imagine that that is much less invasive than traditional open heart surgery.
They sure have come a long way, that's for sure. You know, Hartford Hospital, this is big news. One of the first hospitals nationally to participate in a study involving this procedure in low-risk patients. Tell us about the study and more about what you learned.
Well, first of all, Hartford Hospital was selected to participate in this important study because of the large number of procedures that we do each year, as well as our excellent clinical outcomes. What we have learned so far from this study is that TAVR in low-risk patients is just as good as surgical aortic valve replacement, if not better in some areas. However, the long-term results are still pending. We'll have to wait some time for those results.
All right, more to come, that's for sure. You know, lastly, you've been doing this on high-risk patients for some time now. Tell us about that, and who would be a candidate, really? If anyone at home is curious about this, how can they find out more information about it?
That's a good question. At Hartford Hospital, all patients with aortic stenosis can be evaluated by our heart team. The heart team includes cardiac surgeons, interventional cardiologists, imaging experts, and we evaluate each individual patient's information and make a recommendation based on that information. Sometimes we recommend surgery, sometimes we recommend TAVR. It really depends on each individual patient. One thing for sure, though, is that if you have aortic stenosis, you should come to Hartford Hospital because we can offer the full gamut of interventions for that disease, including TAVR in low-risk patients.
Well said, doctor. That's a good place to end it, that's for sure. We appreciate you joining us this afternoon. And if you at home would like to learn more, or perhaps you need a cardiologist, just like the doctor said, contact Hartford Hospital. There's the number right there on the screen.